Overnight, the first shots of the Pfizer vaccine for kids 5 to 11 going into arms in Connecticut. A line of children eagerly waiting for their turn.
They were talking about going to school tomorrow and telling their friends that they got it. So really kind of ready to get out there and get protected.
The doses coming just moments after the CDC director gave the final green light, following an advisory panel's unanimous vote yesterday to recommend the shots.
We have a total of 14 yeses, 0 no's, and so the motion passes.
Kids will get just a third of the adult dose amount. Early studies found the vaccine to be nearly 91% effective in preventing symptomatic illness in young children with only mild side effects like a sore arm, headaches, or fever, and no cases of myocarditis, that rare heart inflammation seen in some young men. The panel also pointing to CDC modeling, which suggests that vaccinating children could reduce COVID transmission overall in the U.S. by 8% between now and next March, an estimated reduction of about 600,000 potential cases.
Children are going to be able to get their lives back, be able to get back to school, back to in-person learning, back to be around their friends. And this is a huge win, not only for public health, but in terms of mental health as well.
The federal government already shipping out millions of doses across the country.
Right there. 1,000 doses of the pediatric vaccine.
This children's hospital in Columbus, Ohio, stocking their freezers, planning to administer shots today. With about 28 million children now eligible for the vaccine, some parents are eager to get their kids in line.
We feel about it as part of being part of a community where it's helping keeping everyone safe.
But despite promising trial results, a recent poll shows 63% of parents either refuse to get their kids vaccinated or plan to wait.
It's very concerning, especially for 5-year-olds, especially elementary school. The immune system is definitely still developing.
According to the Kids Count Data Center, nearly 1 million children ages 5 to 11 on both sides of the river are eligible for the shot right now. So that does leave some kids who will not be able to get their shots right away. Governor Beshear says Kentucky has enough child doses to vaccinate about a third of the kids in this age group right off the bat. But within the next couple of weeks, he says the supply will be enough to vaccinate up to half of that population. Beshear also says he isn't expecting high demand at first because many parents still feel unsure. Indiana health leaders say they're expecting 200,000 doses this week, which is enough to get shots to a third of that age group as well. There are more than 1,300 sites where children can get vaccinated, with at least one site in every Indiana county. On both sides of the river, you'll be able to get your kids vaccinated at places already giving the flu shot, like pediatricians' offices and pharmacies. Providers say they're trying to make the process as easy as possible.
We're going to handle it similar to what we do with the flu vaccine every year. So if your child is there for an appointment for some other reason, but you're ready to have them vaccinated, we will have that available. We're also going to have special times, special vaccine clinics, so to speak.
Right now, only Pfizer's vaccine for kids has been authorized. Moderna is also working on a vaccine for 6 to 11-year-olds, but have said that they're waiting to file for emergency use authorization for now.